A centennial story from the Portland Clinic. Here's Dick and Liz Clark enjoying a walk through their Southeast Portland neighborhood. Liz recently retired from her work with Portland Charities. Dick, an executive in the medical field, CEO of the Portland Clinic. And it wasn't long ago that neither of these two were walking at all.
I've been flat-footed my whole life and struggled with foot pain, and it has gotten worse and worse.
I started experiencing knee pain in mid-September, and it just progressed.
And so, unlike many of us, Dick and Liz went to the doctor right away. Liz to Dr. Tony McClune, a Portland Clinic foot and ankle specialist.
She took a look at it and said, "Yep, you need surgery."
Liz's problem was a bunion. Doesn't sound major, but
I feel like the terms bunions and hammer toes are kind of they're layman's terms that don't seem like a big deal, but it is absolutely something that can cause limiting daily pain for patients.
Dick saw Portland Clinic orthopedic surgeon Dr. Robert Sandmeyer.
They took a sample of fluid out of my knee and discovered that I had a blood infection.
An infection which required urgent surgery before it moved elsewhere in the body.
So trying to get a hold of it as early as possible is the important thing.
Both operations were successful, but also knocked the legs right out from under these two during several weeks of recovery.
Well, yes. People teased us that at least between us we had two good legs.
We had 2 sets of crutches, and then we got down to only needing 1 crutch each. We had to have one person on the left and one person on the right, depending on where we were going.
For Dick, it also meant packing around an infusion pump for the delivery of antibiotics to block infection. No such problem for Liz. She had another concern: healing in time for the arrival of their first grandchild in California.
And I really wanted to make sure I could go down and take care of my new grandchild without having to drag that boot with me.
Dick's recovery also included physical therapy, plus the involvement of his primary care physician and 2 other specialists, in addition to Dr. Sandmeyer. So the head of Oregon's first multiple discipline medical clinic needed the attention of multiple clinicians.
And the continuum of care of all the doctors that served me was absolutely wonderful. And it wasn't just because I'm the CEO. They do this day in and day out for every single patient.
Including Liz, a 10-year cancer survivor, whose years of foot pain might have served to be a challenge for Dr. McClune.
But she was up to the challenge because it was a little more complicated than a normal bunion surgery would have been.
So for this couple, the experience of getting knocked flat on their backs turned out to be uplifting.
And that was super motivation for us to do everything possible so that we could be ready to be grandparents in early November. We're a big believer that we accompany each other through life. And this is one example of where we accompanied each other.